पिछला इस बार हमने जो नस्या का सेशन लिया था उसी के क्वेश्चन आंसर को हम आज आगे बढ़ाएंगे।
There is no voice.
Sir, questions start करो।
और तेरी स्क्रीन फ्रीज हो गई है। आई थिंक नेटवर्क का इशू है तेरे यहाँ से, आवाज भी नहीं आ रही है।
नहीं आवाज येतोय माझा?
अभी सिर्फ आया आवाज, ये तो इतना, बाकी कुछ भी नहीं आया आगे का। तूने कुछ भी बोला
ना।
हेलो, Avdut's network is little haphazard, so I think we will start the meeting right now. I think we are at least 15 participants right now, and we will start. Sir, the first question that I'm asking is from Dr. Anju Chetia. She has asked that during OPD for diagnostic purpose, when we use 2-3 different nasyas, then what nasya should be given to the patient at home? For Samta, initially Shodhan, later after few weeks Shaman and Brihan. She is saying that she would not prefer giving 3 different nasya preparations to one patient in the same day, as it is too tedious for any patient to use them given today's strenuous life at office and travel. Also, she thinks that as doctors, we need to be confident of using only one type of nasya preparation. So, what could be the answer for this?
Okay. Namaste everybody. Namaste, sir. Namaste. Good evening.
Namaste.
Namaste, namaste, sir. Good evening.
Namaste. Good evening. Yes.
Namaste. Namaste.
Glad to see all of you on this platform. Hello. Hello.
સર તમે સ્ટાર્ટ કરો.
ઓકે. જેનો ક્વેશ્ચન ને એ અનમ્યુટ કરીને પછી વિડિયો ઓન કરે.
સર અનમ્યુટ કોઈને નથી કરવા બીકોઝ બહુ ટાઈમ જતો રહેશે. ઓલરેડી 15 મિનિટ્સ આપણી જતી રહી છે. સો તમે આન્સર સ્ટાર્ટ કરો.
Okay, either one nasya or two nasyas or three nasyas should be given in the same patient on the same day in OPD or at home. That question doesn't arise. First of all, you master one, at least one, giving one nasya at a time to one patient on one day. You master this one nasya, either Pradhaman nasya or Gursunti nasya or some other nasya, depending on the condition of the patient, and it may vary from patient to patient. So give only one nasya initially till you get confidence in practicing nasya. Now what kind of nasya should be given initially as a diagnostic purpose, that depends on the condition of the patient. For example, most of the time it is inflammatory condition, any kind of inflammation anywhere in the body. So any inflammatory condition would warrant the use of anti-inflammatory nasya, and that is Sodan nasya, either Gud Sunti nasya or Sunti Pradhaman nasya, right? So you may try with Sunti Pradhaman nasya initially, which is very safe. If patient is not comfortable, you can use Gud Sunti nasya in lying down position. Even while giving Sunti Pradhaman nasya, while sitting only, patient has to snort the Sunti powder and ask the patient to lie down with the little head extended for a minute or two. That's all. Immediately you will come to know the response from the patient, and if patient is feeling comfortable, your decision is right in using Sodan nasya. Conversely true, if there is a problem, sleeplessness, in those conditions you have to use either Gursunti Gurutanasya or Panchagavya Nasya. Or absolute sleeplessness, you can use even Gogrut Nasya or Buffalo Ghee Nasya. So any patient will require some Nasya or the other at some time or the other every single day. Now if you have started with the Sodan Nasya, you will come to know immediately in OPD itself. You are starting the Nasya in your OPD in day-to-day basis. When you give Nasya and you saw the response, then immediately you can plan out the line of Nasya subsequently at home or in the clinic. You may teach the patient, if patient feels comfortable. Easiest is either Gud Sunti Nasya or Gud Sunti Pradhaman Nasya. Then depending, you have to teach the patient. First of all, you have to learn by yourself whether Sodan Nasya is still required subsequently. If not, then you can switch over to either Panchagavya Nasya or Gud Sunti Gurut Nasya, right? So once you practice one Nasya in one patient on one day, then subsequently you can plan out the Nasya. You can call the patient again after 2 days, 3 days, 5 days, 1 week, 10 days, and then you can plan the Nasya subsequently. So I hope this is clear with you, and don't get into double Nasya in one patient or 3 Nasyas in one patient on same day. Not now, right?
Dr. Anju actually, who had asked the question, was not there in the meeting. She joined just now. So I think once she listens to the recording, she might have other questions for this.
Okay.
So
okay.
I'll go to the next question and I'll just share. What kind of Nasya we should use in sudden traumatic or accidental pain?
In traumatic or accidental condition, depends if there is open trauma, where there is a breach in the skin, then you should be careful. First you stop the bleeding, or if there is no CLW to the patient or internal injury, it is going to give pain to the patient. Now, Shodhan Nasya can also be used as a painkiller, as a analgesic Nasya, or anti-inflammatory Nasya, or anti-allergic Nasya. So you can plan out in a condition, you can straight away give Shodhan Nasya, just for a short period. If patient feels comfortable in the pain, then you may continue for a day or two, twice a day, or maybe every day, or maybe every second day or third day. And you will come to know now patient doesn't require any Shodhan Nasya because the pain has vanished completely. Then you may try, Shaman Nasya. I think by then the patient is quite comfortable as far as pain part is concerned. Meanwhile, you get breathing time to treat the condition. If there is CLW, the patient may require suturing. If there is internal injury, if fracture, then you can refer the patient to orthopedic surgeon. If there is head injury, it is entirely a different situation. Depending on the condition, you may have to refer to the neurologist, right? Then internal injury, like certain stab injury, Shodhan Nasya, and if there is a condition like any fracture of the rib, or there is sudden pneumothorax, you may use Shodhan Nasya, right? Sudden acute rhinitis or acute rhinopharyngitis or acute laryngopharyngitis or acute redness in the eyes, either one eye or both the eye, or acute exacerbation of the glaucoma. All this warrants Shodhan Nasya. Straight away Shodhan Nasya till patient gets some relief. Once after getting the relief, then you can plan out at ease whether patient requires Shaman Nasya later on. Or you can plan out the Shaman Nasya and then later on Brahman Nasya if necessary.
Sir, there is one practical question about the difference in the drops reaching in left and right nostril. Like in left nostril, the nasya reaches in 2-3 drops, and the right nostril it reaches till 6-7-8 drops. Then in that condition, what should be understood, the samata or niramata of that patient, and whether we should continue the nasya in how much quantity?
Although the question is not clear, it is your voice is breaking.
So the question is like practically when we put the Gudshunti Nasya in the clinic, so sometimes in one nostril drop reaches in 5 drops or 10 drops, in other nostril the drops reaches in 15 drops, 16 drops. The number are different in different nostrils. So what we should interpret by these numbers, if the one nostril is reaching in 2 drops and other nostril reaching in 10 drops.
I will give you one analogy. Does any patient gets cataract bilaterally, or first in one eye and then other eye cataract development? It may be different, no? At one point of time patient may get cataract in one eye, and after some time patient may get cataract in other eye. Similarly, here one sinus may be loaded with phlegm, other sinus may be less loaded with the phlegm. The one which is loaded will require more number of drops of good Sunti Nasya, and the one where there is less phlegm will require less number of drops to reach. But ultimately our goal is to put the Nasya in the nostril to reach at least at the hairline on both the sides. Whether one nostril requires 4 or 5 drops, other nostril may require 10 or 15 or 20 drops, no problem. But it has to reach from both the sides till at least to both the temples and the hairline. Number of drops in each nostril may vary depending on the intensity of the problem in individual sinus. So nothing wrong, different number of drops put in each nostril. Right?
Okay. So in that case, we should put more drops in the blocked nostril only, and the
Yeah.
one which is clearer, we can stop putting it
See,
at that
start putting
time.
start putting the Nasya in one nostril. One drop on the left side, one drop on the right side. Second drop on the left side, second drop on the right side. Third on the left, third on the right. Then fourth, fifth and fifth. Now in one of the nostrils, fifth drop of Nasya would reach the that side of the head and reach the hairline here. So further you don't put in that nostril, put in the nostril where it has not reached. Go on putting 6th one, 7th one, 8th one, 10th one, 12th one, 15th one, 20th one. Even if it doesn't reaches in 20 drops in that nostril, doesn't matter. You may try second time, maybe in the evening, maybe next day, maybe third day. Ultimately, his sinuses should get opened up. That many number of drops are required to reach the top of the head. See, at least hairline, right? So once you practice, automatically it will get clear to you. You will get more confidence.
Okay, sir. Yes.
Okay. So the next question is, when we are using Nasya as a diagnostic tool, and if it is Samavastha, do we not need to use oral medicines for Ampachan? Can only Nasya remove Samta?
It may happen so that only Nasya may be enough to correct the Samavastha of that patient in that condition. But it may not be true in every patient every time. So this will at least guide you how many number of drops patient requires to reach the hairline at least. If it has already been, this point has been covered. If 5 drops, then it is almost Niramavastha. 5 to 10 drops, 10 to 15 drops, 15 to 20 drops. So more number of drops moves towards more Samavastha. Less number of drops moves towards Niramavastha. So put in every patient, you will come to know how much is the Southern Nasya is required in each nostril. And this is your diagnosis. At the same time, once you know it is Samavastha, you can start formulate the medicines to correct the Samavastha of the patient with oral medication. And if Samanavastha, if there is both the sides there is Niramavastha, you can formulate the medicines to treat that Niramavastha with oral medication. This will at least guide you whether to start with Samata or will start the Niramavastha. I will give you one example. Patient comes to you with arthritis. You don't know whether it is Niramavastha or Amavat, because patient has tried so many other medications, even allopathic medications. So symptoms what patients are giving is not 100% true. So it may be, there may be masking of the symptoms of that patient of that particular disease. Now what needs, what we feel it is Niramavastha, actually it may not be Niramavastha, it could be Samavastha, because Samavastha has been masked with other allopathic medicines or any other medication. So you don't know whether it is Niramavastha or Samavastha. So best way to know the condition of the patient is give Southern Nasya. If patient feels comfortable, then you have to presume this is a Samavastha. If patient gets Niram or Sam can be differentiated easily, and accordingly, once you label the patient as Niramavat, you treat the condition as a Niramavat. When the patient you feel it is a Samavastha or Amavat, you treat the patient with Amavat. So it becomes so simple, and at the same time you are not missing out any other condition, even if it is masked problem. And there is the effect of other medications. Patients are on disease modifying agents in Amavat. So you will not know whether it is really Amavat or Niramavat. And when you are treating Amavat as Niramavat, the patient's Amavastha will aggravate. If you treat Niramavastha as Amavastha, then Niramata will get aggravated. So in either situation, you are not doing good for the patient. So in this situation, your Nasya would be really helpful as a diagnostic purpose. Is that clear?
Yes, sir. So next question is from Dr. Sajjala Joshi. She is asking what is the maximum quantity that could be put in the Nasya of good
Maximum
Shunti.
quantity of which Nasya? Good Shunti Nasya?
Of good Shunti Nasya, yes.
Okay, good. See, good Shunti Nasya, when you are practicing Nasya in a very initial phase of your practice, then you should not exceed 15 drops at a time in each nostril, 15 on each side. Don't exceed 15. Then it may not be, you may not get Niramavastha in that patient. So use it second time, or use it next day, use it third day, use it fourth day. Slowly 15 drops will not give Niramavastha, slowly it will give Niramavastha, then 14 will give Niramavastha, maybe then 13, maybe 12, then 10, then 8, then 5, then you have converted the Niramavastha into, you have converted Samavastha into Niramavastha, which may take 1 day, which may take 5 days, which may take 15 days. So till then you have to go on giving Sodhan Nasya. Is that clear?
Okay. Yes. So the maximum quantity
But you should not
be
exceed
15 drops.
You should not exceed 15 drops initially. Once you master Nasya, then you may use anything.
Okay.
Okay. Next question is again from Dr. Sajjala, and I think she has tried Nasya very well in the patient. She has put 80 to 90 drops also in a patient. So she has asked that in some patients, even if you put 10 to 12 drops, there is excess burning and there is lot of cough that comes out. But in some patients, she has put 80, 90 drops, and in spite of that, there is hardly any cough expectoration. Then what should we understand? Is it excess Vat? Should we put Tel Nasya or should we put Ghut Nasya in such cases?
See, first of all, you are not exceeding the number of drops, 15 drops in each nostril. You should not put 80 or 90 drops in one patient. You may have to repeat number of sessions, Sodhan Nasya, maybe once a day or twice a day. Maybe you may continue with second day, third day, fourth day, fifth day. Suppose with few drops only, the patient gets lot of phlegm. That means it was a samavastha of kapha. Or if patient may require lot many number of drops, but not 80 or 90, but more than 15, then you may presume this is a samavastha. So don't switch over to the other nasya. Continue with Sodhan Nasya every day. And slowly, less number of drops of nasya will give a result which is approaching Niramavastha. Once Niramavastha is achieved, then you may switch over to the Shaman Nasya. Now, in certain special situation where we are sure that patient has got Samavastha and still 20 drops also are not reaching the top of the head, then what I do is you increase the concentration of the Nasya by double. double amount of ginger powder is to be put in preparing the nasya, but you are not supposed to at this stage. You forget about you using the double concentrated good sunti nasya. Continue with not more than 15 drops, but continue every day. So that will indicate, a lot of samavasa is there. That samavasa may be kaphaj, maybe pittaj, maybe vataj. Once you get niramavasa, then only you switch over to saman or dhanasya. Even if you are wrong, by mistake you have put good sunti nasya, there won't be any harm to the patient. And you will come to know what avastha patient is having. Right? Fearlessly use nasya in every patient, there won't be any problem. And you will learn from every single patient in every single disease at every single phase of the disease. Anshans kalpana will be very clear in every patient. Yesterday or last week or last 15 days back, patient required 20 drops and continued every day 20. You have teach the patient, if it reaches the top of the head, reduce the number of drops, maybe 19, maybe 18, maybe 15, maybe 10. Slowly you will know that samavasa is now reaching niramavastha. Right? Once niramavastha is achieved, then you may switch over to saman nasya or brahman nasya, depending on the condition of the patient.
Okay, sir. Very good. One more question is from her, that sometimes the nasya reaches in the occipital region or behind the ears. Patient feels directly sensation over there instead of top of the head. In that condition, what should we understand?
Now, how many number of drops after putting? How many number of drops it has reached the occipital region or bitemporal region, and not the top of the head? How many drops? At least one point is clear, that patient is suppose 5 drops and reaches the bitemporal region or occipital region or not the top of the head. Doesn't matter. Patient is getting into niramavastha. Maybe second time if you put next day or maybe on third day, then it may reach the top of the head. That means you have cleared off all the samavastha from the head. Bitemporal, occipital, then frontal, and then top of the head. Once it reaches the top of the head, you have cleared off all the samavastha of the patient. Right?
But for that day, we should stop putting nasya if it reaches in the occipital region.
No.
Say for example, after putting 6 drops.
So next time you put only 5 drops. Next time you put only 4 drops.
Okay.
Right? And even if it reaches, it may give little burning sensation, little heaviness in the head. Doesn't matter. If there is some problem, you sprinkle water on the face of the patient, or you may ask the patient to lie down on either side and put little water on the forehead or maybe on the top of the head. But it doesn't happen. Usually I have not seen such cases in so many years of my practice.
Yes, sir.
So don't fear and start.
So the next question is, who is contraindicated for Pradhaman Nasya, and can we give Pradhaman Nasya to glaucoma patient and timid patient?
Come again, repeat the question.
Who is contraindicated for Pradhaman Nasya? Can we give Pradhaman Nasya to timid patient, or can we give Shodhan Nasya after food?
Shodhan Nasya after?
Food.
After food. See, there is no condition for using Sadhya Nasya. Before food, after food, morning, evening, night, any time you can give. There is no specific timings in putting the Nasya. Now, what are the contraindication of Pradhaman Nasya, right? Now, Pradhaman Nasya cannot be given in patients with hypertension, in patients with acute glaucoma, in patients with hyperthyroidism, or patients who are either pregnant or during menstrual cycle, or you can give in the lactating phase, no problem. Pradhaman Nasya. So these are the contraindication of Pradhaman Nasya. Now as far as glaucoma is concerned, and patient is on treatment, putting drops in the eyes for glaucoma, and patient keeps putting drops for number of months and number of years, and still glaucoma intraocular pressure keeps varying, from 12, 15 to 25, 30. Though patient is putting the drops regularly every single day, so there is no fun in putting the allopathic drops. While here you have to consider what is the samprapti of glaucoma. It is usually Vata and Pitta. Initially it may be some avastha of Vata and Pitta, so initially you put Sodan Nasya and Gudsunti Nasya in the form of Gudsunti Nasya. If patient feels comfortable, go on giving Gudsunti Nasya for 1 day, for 2 days, for 3 days, for 5 days. Once patient feels very comfortable, very comfortable, then you have confirmed now less number of drops are required to reach the top of the head. So then you may switch over to Saman Nasya in glaucoma, whether it is wide angle glaucoma, whether it is narrow angle glaucoma. It is the cuff it is the samavastha that gives a condition of glaucoma. Eventually, patient ophthalmologist will confirm that the patient's intraocular pressure is consistent all throughout at normal level. Then the doctor himself will discontinue his drops for glaucoma.
Okay. During migraine attack, which Nasya can be given?
So you should know, before using Nasya in any condition, you should know the samprapti of the condition. Now in migraine, what is the samprapti? Usually it is Vata and Pitta. But migraine could be because of the acute sinusitis also, looks like migrainous headache. Or there may be some other reasons, like other reasons will include AVM, arteriovenous fistula, and giving rise to migrainous, so-called migrainous headache. You don't know what exactly is going on unless you get the patient's MRI done or MR angiography done. But suppose you want to treat patient of migraine, first you start with a small dose of Gudsunti Nasya. Now if you are still in doubt, you better use Gudsunti Grit Nasya or Panchagavya Nasya to begin with. If patient gets relief, then it implies that patient has got not so much of samavastha. And then you can again confirm the condition of the patient by giving Shodhan Nasya after giving Panchagavya Nasya. This is a situation where you have to recheck either first Shodhan Nasya and then Saman Nasya, or first Saman Nasya and then Shodhan Nasya, depending on the condition of the patient and your level of confidence. And patient is not going to have any problem. Once you determine this is the Pachaman avastha of those doshas, you can give Saman Nasya and later on Brohan Nasya. But always recheck with Shodhan Nasya periodically in cases of migraine. Right? Is that correct?
Yes, sir.
You don't know whether patient's migrainous headache is because of aneurysm. Because of aneurysm. Are you getting my point? Now, aneurysm also can give rise to migrainous attack, not migraine. It is migrainous attack. But in that case, and suppose you know it is a aneurysm giving rise to headache like migraine, with the help of MR angiography or MRI, then you may start with Saman Nasya. Don't start with Shodhan Nasya. Once Saman Nasya is given, patient's migrainous headache comes down slowly. Then periodically you keep checking, either with a Sodhan Nasya or with Brown Nasya. Even you know that this is a headache is coming because of the aneurysm. And you may take help of neurophysician or neurosurgeon depending on the severity of the condition. Whether patient requires coiling treatment, surgically coiling treatment to diffuse the condition. But till then, you have purchased, you have bought the time. Keep the patient at comfort level and then take the opinion and treat the patient accordingly. In case of cerebral aneurysm, gives rise to headache like migraine. There may be referred pain, which again would mimic like a migraine. That referred pain, you should know whether it is coming from the ear, it is coming from the cervical spine, or it is coming from the neck vessels. All those conditions you should be knowing. But safe condition where you think it is headache like migraine, always first start with Shaman Nasya. Don't start with the Sodhan Nasya. Once or twice or thrice you may put Shaman Nasya, then you may check by giving Sodhan Nasya. Whether Shaman Nasya has given good result or Sodhan Nasya has given good result, that will give you the initial situation, whether patient was in Samavasa or Niramavasa retrospectively. And then you can continue whatever is the condition of the patient. Is it clear?
Yes, sir. Yeah. So there is one more question, that whether the Nasya should be put on specific timing according
Avadut,
to the
it's not
dosha
audible.
which we
It's not audible.
suspect.
Avadut, it's not audible.
Okay.
तू काढून टाक ना
अच्छा,
नाहीतर
अच्छा. I
बघू
will
काढून
check.
बघ.
Yes. Yes. येतोय आवाज सर?
हा,
आता आवाज येतोय सर?
आता एकदम चांगला येतो.
Okay. Ha. Sir, the question is, okay. So the question is whether we should put Nasya on different timings according to the doshas which we suspect. For Vata different, the day of time, in the morning or afternoon, evening. According to dosha, should we suggest or we should put on a regular timing?
We are giving Nasya as a, this point has also been covered last time. We are giving Sadhya Nasya, remember, which doesn't require any timings. When patient has arrived in your clinic, that's the time to put the Nasya. There is no specific timings for the Nasya. Then depends on whether patient requires Shodhan Nasya or Saman Nasya or Brown Nasya. Then you can switch over the appropriate timings if it is Saman or Brown Nasya. Otherwise, Shodhan Nasya doesn't require any specific timings. But by practicing on different patients, you will come to know when to put the Nasya. But Sadhya Nasya doesn't require any specific timings. You can put any time.
Okay.
Very safe. And doesn't require any special preparation like Purva Karma, Pradhan Karma, Paschat Karma, nothing. Just put the Nasya and get away with the problem.
Okay, sir. Yes, clear, sir.
What next?
Okay.
You
Dr.
mentioned the name of the Vaidya who has asked this, any question.
Sanjana. Dr. Sanjana has asked a question.
Huh.
She has asked a question. Sometimes we give Shinti Pradaman first and then GS is put. Sometimes we reverse it, vice versa. In which condition, which Nasya is planned this way?
She may be right in either situation, if she knows what she is dealing with. Suppose patient, I'll give you extreme condition. Patient has got requires Sunti Pradaman Nasya. Sorry, good Sunti Nasya. And patient is having severe pain from cervical spondylosis, where patient cannot adopt the right posture to be given for the Nasya to be given. So in that case, though it is not indicated, good Sunti Nasya is not possible to put into the nostril in lying down condition. Patient is not able to lie down. So in that situation, first you give Sunti Pradaman Nasya while sitting only. While sitting, though it is not indicated, but still you are not wrong. Once patient feels comfortable, ask the patient to lie down slowly with the appropriate posture to put the good Sunti Nasya, and you will succeed in giving good Sunti Nasya, and he will have proper right result. So this is the condition where you have to first give Sunti Pradaman and then good Sunti Nasya. That should be done, in almost in the interval of 10 to 15 minutes time.
Okay, sir. Sir, one question is regarding Ashtotan. That should we put Ashtotan for each patient for which we are using Good Shunti Nasya? That before we should put Ashtotan and then Good Shunti Nasya?
Giving Ashtotan Nasya is not like a fashion. But by giving Ashtotan, you are making the patient relaxed completely. Because eyes has also connection with the brain. As nose has connection with the brain, eyes also have connection with the brain. So both the ways you are making the patient feel more comfortable, very much comfortable, right? Where other medicines, oral medication or any other kind of medicines, or maybe seroviration, so many other types of treatment may not give instant result like Nasya and Ashtotan. This is the shortcut and shortcut. Patient will feel very comfortable and you will feel more confident.
Yes, sir.
Okay. So the next question is not regarding per se Nasya, but it is about the position of Nasya. If a patient has cervical issue or spine issue, and even after giving a proper position, the head is not reaching the bed, how should we adjust the position for Nasya?
If you are bent upon giving good Sunti Nasya or good Sunti Grita Nasya, you have to give appropriate position to put the Nasya. Now, conventional method, what has been described earlier with a picture, if that is not possible, then raise the buttock part of the patient by inserting some height, folded blanket or some pillow under the buttocks, right? So automatically the spine raises, the back, lower part of the spine raises and upper part spine goes down, and then by giving appropriate roll under the neck, you may be able to succeed in giving appropriate pose and then put the Nasya accordingly. But still, if there is problem, give Pradaman Nasya, ask the patient to relax, spend 10-15 minutes, ask the patient to wait in a waiting room after putting Sunti Pradaman Nasya. After about 15 minutes time, patient is relaxed, and then it is easier to adopt the right posture to give appropriate Nasya, whichever you like the best for that patient.
So one question is that what to expect when the patient says there is no change in his condition, he is not feeling any change after putting the Nasya, then what should we understand from that?
It gives total samavastha, where you may not get
Yes.
any response from the patient by putting either Sunti Pradaman Nasya or good Sunti Nasya. You may not get anything, right? Suppose there is a lot of Niram Avastha of Vata, then the response would be immediate. But samavastha of vat you may not get the response. In any condition, if patient doesn't get any response by putting the nasya, you may presume that patient has got lot of samavastha. Go on putting every day, every day, every day. Time will come when at least 15-20 drops will reach little in the like in the head, particularly eyebrows. Then again after few days, put the same nasya, it will reach the middle of the forehead. Again after few days, it will reach the top of the head, hairline, and then top of the head. So you have achieved. May not be on the day one. It's not necessary you will get the result on day one. Depending on the condition of the patient or the severity of the problem in that particular patient, you go on giving nasya. Right.
So we need not take a break. We till the samavastha is there, we should keep.
Why should you get the break? Patient may require number of days in putting the nasya. It may require 1 week, may require 2 weeks, doesn't matter. But in that case, we increase the concentration of nasya by double concentration of good sunti nasya. Right. So it is there is no problem in giving nasya every day.
Right, sir.
Avdut, when last 5 minutes you let me know, I will cite two very interesting cases that will clear up so many doubts, in everybody's mind. Yes. Next question.
Yes.
There is a question from Dr. Charu Smita Shah. She has asked that sometimes Shunti Pradaman does not cause any burning, and in the same patient, if you give Gul Shunti Nasya, whereas the Shunti Pradaman has not even reached up till the top, but Shunti Pradaman reaches directly to the skull. She tried giving Pradaman with a straw, with the hand also, but there was no effect in Pradaman, but Gul Shunti worked very well. So how to interpret this?
See, first of all, what ginger powder you are using for a Shunti Pradaman Nasya should be finely powdered, and it should be sieved through the muslin cloth. So the particle size is very, very small, like nanoparticle. And then try to put. And still if it doesn't go, no problem, because it is in the powder form. While good Shunti Nasya is in liquid form. The liquid is absorbed by the mucous membrane very easily as compared to the powder form of the Shunti. So no problem. If Shunti Pradaman doesn't reach, you can give good Shunti Nasya. Ultimately, you are sticking yourself to Shodhan Nasya. That is what is more important. Right?
Yes, sir. So there is question about whether we should put a Pradhaman or Good Shunti Nasya in a case of hypertension. Pressure, blood pressure is raised.
Good point.
Yeah.
Good, very good point. This is a question of at MD level or maybe PhD level. Hypertension, Samprapti, as everybody knows, is because of Vata and Pitta, right? Now here, when you are practicing Nasya in Ayurveda, you should also know that it's only not only Vata and Pitta which is supposed to be in Niram Avastha, but suppose it is some Avastha of Vata and Pitta, and yet there is hypertension. Hello? Is it clear? Hello?
Yes, sir.
Suppose it is Vata and Pitta of some Avastha. Condition is same, hypertension. There are two cases of hypertension. One is with Samavastha, Vata and Pitta. Other is with Niramavastha of Vata and Pitta. Both will give hypertension. Right? I have seen cases of 220 over 120 without any symptoms. Without any symptoms. So I presumed it could be Samavastha I started Sodhan Nasya. But while giving Sodhan Nasya, I had kept Gud Sunti Grut Nasya ready. So by giving Sodhan Nasya, Gud Sunti Nasya, if patient feels comfortable, better, and immediately the patient's BP would come down slowly. Now continue with the Sodhan Nasya till patient is comfortable, and then you can switch over to Shaman Nasya, considering that now Samavastha of Vat and Pitta has now come back to Niramavastha of Vat and Pitta, and then you treat it according to the regular course of medicine. You can still give good Sunti Nasya, but keeping BP under control, and always watch the BP periodically.
Yes.
Hello.
Okay, sir. Yes, sir. Got it.
Okay. Sir, this question is by Dr. Charusmita again. She's asking, what instruction do we give for follow-up Nasya? Suppose we have called the patient today to the OPD, we have given Nasya today. Then when should we call them back? I think she has not given it to the patient at home. So, like how we give it?
I'll tell you what we do is we give Sodhan Nasya, and if we think patient is comfortable with Sodhan Nasya, ask the patient to continue with the Sodhan Nasya at home, but instruct and teach the patient properly and proper position in putting the Nasya. Ask the patient to put it every day, and ask the patient to report to you when patient feels still more comfortable or maybe little worse condition. So ask the patient to come back in our clinic, and then you review the condition and then prefer the appropriate Nasya at that point of time.
Okay.
You should always ask the patient to call up, in every day or every alternate days. Only calling up, or if necessary, if patient is not able to come whenever you want to see the patient again, then you can ask the patient to communicate with you on video call, keeping the eye on the BP level.
Okay. So what should we do when the patient is having severe sneezing? At that time, which Nasya should we prefer?
Severe sneezing, severe Sodhan Nasya required. Sunti Pradhaman Nasya, very, very simple. Because Sunti here will act as an anti-inflammatory and anti-pruritic agent. So sparingly you should use Sunti Pradhaman Nasya along with some other line of treatment,
Okay, sir, how does Panchavya Grit Nasya help in hormonal issues?
Help in?
Hormonal issues.
Hormonal issue, you mean to say intracerebral problem like hypothalamo pituitary or hypothalamo thyroid or ovaries or suprarenal gland. If you feel it is Samavastha, give Sodhan Nasya. If you feel Sodhan Nasya is now patient is much comfortable, and then you can switch over to Shaman Nasya. This is all endocrine gland Nasya is excellent, particularly where hypothalamus is involved, where pineal gland is involved, where thymus gland is involved, where thyroid gland is involved, or whether pituitary gland is involved in any condition like thyroid or in the PCOD, PCOS in female, or primary or secondary infertility in female, or even infertility in male. So even for loss of libido, so many conditions you can use Nasya sparingly. Also neuroendocrine glands, you can use Nasya. Rather, Nasya is the only tool. Rather, only first line of treatment is Nasya in intracerebral problem or endocrine gland problem or neurological problem. or rather even psychiatric condition, Nasya is the best treatment. Then you may combine with either Basti Karma or other medication. But first line of treatment is Nasya. You want to elaborate? You want me to elaborate a little more? Hima?
I think just
You want me to
try
elaborate
out
a little more?
if you can, sir.
Huh?
If you can, wonderful.
Okay. Okay. I'll give you a simple example, and it is an eye opener. Young lady comes with a history of menorrhagia, dysmenorrhea, or menometrorrhagia. You will immediately think patient requires, if Nasya is to be given, patient requires Shaman Nasya or rather Brohan Nasya. Here I differ personally. You don't know. It is Pitta and Vata Prakop, and coming from the hypothalamo-pituitary ovarian axis, hyperactive. Here we feel it is Pitta and Vata Prakop, Dushit Rakta Prakop, but it could be of Samavastha. So initially you give Shodhan Nasya a little. If patient feels comfortable, you presume it is Samavastha of Pitta and Vata in menorrhagia, menometrorrhagia, dysmenorrhea. Give this Shodhan Nasya for a day or 2 or 3 or 4 or 5 or 1 week or 15 days. Patient will go on complaining not rather complaining. Patient will give a response that patient feels much better. And then depending on the condition, after about 10 or 15 days, then you may switch over to Shaman or Brohan Nasya. Similarly, epistaxis or bleeding piles. Bleeding piles is also Pitta, but it is Dushit Rakta and Pitta. So give Shodhan Nasya and bleeding will stop. In epistaxis, initially you put Shodhan Nasya and then immediately Shaman Nasya. The epistaxis will stop. Similarly, bleeding anywhere in the body, GI bleeding, duodenal ulcer, peptic ulcer, give Shodhan Nasya a little and then Shaman Nasya. It will work wonder. Because you have already treated the Samavastha of that dose, either Pitta or Vata or Kapha. Of course, this is little very sensitive and very delicate situation. But practice you will come to know what Nasya is to be given in these conditions.
So, sir, in epistaxis, should good Shunti Nasya should be used as a Shodhan or Shunti Pradhaman should be used?
No,
then?
good Shunti Nasya. But while giving good Shunti Nasya, keep good Shunti Grita Nasya or Panchagavya Nasya ready. If patient feels uncomfortable, put good Shunti Grita Nasya or Panchagavya Nasya. You won't go wrong. But you have already cleared off the Samavastha, if at all it was there. And if it was Niramavastha and yet you have given Shodhan Nasya, switch over to Shaman Nasya immediately.
So regarding Shodhan Nasya, there is one question in the chat box that since oil is easy to carry and everything, so can we use Sharbindu tel as a Shodhan Nasya instead
Sharbindu tel can also be given as a Shodhan Nasya, provided you are sure that there is a Sama Kapha. Then you can use Sharbindu tel, no problem. But Sharbindu tel you have to procure from appropriate place, then how to use. While here it is very simple, Sunti Pradhaman or Mud Sunti Nasya. If patient has ginger powder, patient has jaggery in his house, easily available, easy to prepare, and you have to prepare this every day. Once you have achieved certain good level, then you can switch over to tail Nasya, right? Next.
Sir, there is another question in chat box. What kind of Nasya can be given in recurrent or threatened abortion cases?
I must congratulate this questioner. That's a very good question. In threatened abortion or recurrent abortions, right? What is the cause of threatened abortion? What is the cause of threatened abortion or hello?
नहीं खा रहे? नहीं मेरे को नहीं खाना। कौन सा मुझे मेरे को आवाज आ रही है?
Hello,
मेरे
hello.
गाला था कलेक्टर तेरा दिमाग नहीं खराब कर। चालू ही रहता है।
I think
मुझे थोड़ा
some disturbance is there.
नीचे कर रहे हैं।
I will just
Hello.
mute the participants. Sir, wait.
Hello. Threatened abortion and recurrent abortion, right?
Yes, threatened what kind of Nasya can be used in threatened abortions or recurrent abortions?
See, you have to find out the pathophysiology or samprapti in that condition. Why threatened abortion and why recurrent abortions? It is either samavasa of vat, samavasa of pitta, or samavasa of kapha. In different situations, the samprapti may be different, but it is the samavasa that giving rise to this situation like threatened abortion or recurrent abortion. So give Sodhan Nasya. See the condition. I had one patient who was primary infertility, and topmost doctors in Bombay, South Bombay, had given treatment to this patient. They ultimately said after trying IUI, IVF, everything, then the gynecologist said you cannot conceive. So patient was absolutely given up the hopes. Then she came to me. I gave her Sodhan Nasya. Can you believe you can give Sodhan Nasya in such situation? And patient started improving. One day, first phone came to me, not even her husband, that she missed her period and urine test was positive for pregnancy. She went through the whole process. Beautiful, throughout 9 months she was so healthy, and she delivered a healthy baby and with a normal delivery. She took this baby to the same gynecologist who had said, declared that she won't get pregnant. That gynecologist said, I can believe you because I can see your daughter here, but I still don't understand how you got pregnant. This is all because of Nasya. Of course, with other line of treatment. But Nasya gave way. It opened up the windows for pregnancy. Am I clear?
Yes, sir.
I think we should, yeah, sir. You were about to tell about the two cases.
Yeah.
The last.
Yes. Now, one case which I learned from my own experience. I mean, with a patient. Patient has chronic pain in the shoulder, in the neck, in the trapezium, trapezoid, and down below the lower back. Patient has suffered since so many years. Patient had been to top neurologists, top orthopedic surgeons. They give different types of treatment, including even physiotherapy, intense physiotherapy. Because of this problem, patient could not sleep at night. It would pain on either side. So patient had to give up her job, very prestigious job in US. When she came to me, I presume this was a Niramavastha. So I gave her Shaman Nasya, Bhron Nasya, Shaman Nasya, Bhron Nasya. Today when she came, Today itself, when she came, I said, let me try Southern Nasya, which was little difficult. The situation was very delicate. So I gave her Gursunti Nasya without any Shaman Nasya or Brown Nasya initially. Immediately she said, my first time I'm getting this result after such a long period just by Southern Nasya, Gursunti Nasya. She was so happy. So here I got the clue that what we think Shaman or Brown Nasya required, actually it is Southern Nasya to begin with, and then you may switch over to Shaman or Brown Nasya depending on the progress of the disease. This is one case. Second case, very, very eye-opener. One patient came who was 65 years old. Patient's complaints were severe pain in the legs. Patient could not sleep at night. Patient would keep on bouncing the legs on the bed like this because of the pain, and the patient could not sleep at night. Sleep was very, very bad, disturbed sleep, and severe headache, severe backache. This story was going on for last 40 years. 40 years. You can imagine patient must have tried anything and everything. Anything and everything in different branches of medicines. Today, surprisingly, he came to me without any intention. Somebody recommended, patient came to me. I will give you one hint. When I thought patient is suffering for such a long period of time, agonizing pain, his family relations suffered, his business suffered, his interpersonal relationship suffered, his business circle also got suffered. I thought it looks like psychosomatic problem, more of functional than of organic problem. So I give Shaman Nasya, Panchagavya Nasya, and I give Ashchatan Nasya. Ashchatan drops. After about 15 minutes, patient already started getting comfort level. Then I put Gursunti Nasya. Very interesting. Patient came down from the bed. He was in tears. He said, in 40 years of time, first time I'm getting so much of relief and so much of relaxation. So much of relief and so much of relaxation. In the last 40 years time, I have not seen this kind of relaxation. He cried out of happiness. Then after giving certain postural correction, his pain vanished completely. He said, I feel there is no legs. He was so comfortable just by giving Nasya. He must have tried even Ayurvedic medicines in different, patient came from Ludhiana. This is just to give you a hint, so many problems we may miss out. But consider psychosomatic problems. There is nothing wrong in giving Nasya. The patients who are submissive, elevate them. Those who are hyperactive, slow them down. And your problem becomes very easy to treat. Once mind is released, body automatically gets released. And by giving little medicine, patient feels more comfortable. Any question? Any question after so many questions?
Two more are pending, sir.
Okay.
Three questions are pending. So I will combine all three and pose that last question, and then we can conclude. So the question is, what kind of Nasya can be given in a herniated disc and autism spectrum? And the second part of the question is, if GS Nasya reaches the top of the head in 4 or 5 drops, should we still continue to do it or stop or change?
This shows lack of practice on Nasya. When 4 or 5 drops the top of the head, reaches the top of the head, that means patient is in Nirama Avastha. So don't continue with the Sodhan Nasya. Start with Saman Nasya or Bhraman Nasya if necessary, and after 2-3 days again recheck and may start give Sodhan Nasya for a day or so. Then again switch over to Saman or Bhraman Nasya. This is how his condition will go on improving every single day. There is one part. Second part is in autism. The cause of autism is what? What is the cause, Samprapti of autism? Mainly Sama Kapha or Sama Kapha and Vat. Right? So Sodhan Nasya, it warrants Sodhan Nasya and patient improves. Last time I must have narrated one story of 15 years old boy with stunted growth. So his hypothalamo-pituitary axis was slowed down, and it was not secreting growth hormone adequately for the growth of the child. Otherwise, it was very sharp, very intelligent. So I presumed it was Samavastha in the head. While examining the head used to feel very heavy. I showed his mother, see this weight of the head while lifting in lying down position. Then I put Sodhan Nasya, Gudsanti Nasya. After 10 minutes, I asked the mother, check again. The head became very light. So I'll give you one hint. Those patients whom you feel that heaviness of the head is there while lifting the head in a lying down position, any condition, any disease, irrespective of any problem, presume this to be Samavastha of anything, either Samavastha of Kapha or Samavastha of Pitta or Samavastha of Vata or Samavastha of dual combination, Samavastha of Tridoshas combination. It is Samavastha. Give Gudsanti Nasya and instantly there will be correction. Immediately patient head becomes very lighter. The whole body would get relaxed. Patient came after 1 month. Patient came from out of station. He came after 1 month. Mother said that I feel he has become still more active, very smart, and his height seems to be improved. I have not measured the height, but apparently it looked, his height is little better. He felt little elevated. So this is the charisma of Nasya, right? So autism, any such, even genetic problems also, you can ultimately genetic problem or any such problems, they have to be either Vat, Pitta or Kapha. None of the disease in the world today and tomorrow, in future also, will be without any doshas like Vat, Pitta and Kapha and different combinations. So presume that and you formulate the Nasya in that patient. It will become very, very easy. And that's what we are, I'm going giving more stress on practicing Nasya. You will be number one up than your colleagues in your field. Practice Nasya. This is a take-home message. Practice Nasya every single day. Go on noting down your experience and your data and what patient is giving, different kind of patients. Any problem, you can put down your question in the link given below. You will be answered. But go on practicing Nasya. Don't get frightened. Give Nasya. At one point of time, you will feel Nasya is giving you more efficiency and more confidence. Patient is getting more confidence, and that one patient will bring so many other patients to you. This is our experience. Anything else?
I think the questions are over.
Sir, herniated disc. Herniated disc.
Hernia or herniated disc?
Herniated disc.
Who is this? Who is the questioner?
Sajjala.
Sir,
Hello.
hello, sir.
What is the pathology of herniated disc? Some proxy of herniated disc.
So due to what and cough?
See, there is displacement of the disc, right?
Yes.
You will see all the orthopedic surgeons are very stout, very bulky, right? They need lot of strength in performing surgery on the spine. So for the displacement of the disc, lot of effort is required, lot of pressure is required. So what only has got that kind of pressure, that kind of impact. So if it is connected with Vat and Kaph, one situation, Vat and Pitta, another situation, and third situation is what? Vat and Vat. So all three are different. So in that situation, I'm not going in the detail today right now because we are running out of time. But predominantly it is Vata, Vata's Vyadhi. Now you presume this is Samavastha of Vata. Give Sodhan Nasya and you will see how Nasya will work in the spine. Every single cell of the body, every single cell of the individual organ or individual system is connected with three things. What are those three things? Artery, vein and nerve. It is called as vein, V-A-N, vein, artery and nerve. Every single cell is connected with these three things. Now pain part is created by Vata or combination of Vata plus Pitta or plus Kapha or plus different Vata. So predominantly it is Vata. So when it is Vata, it is spinothalamic tract, from the brain through the spinothalamic tract to the nervous system, and there is a problem in the spine. So presume this to be Vata of Samavastha. Treat the patient with Sodhan Nasya. And you see, immediately within 5 to 10 minutes or 15 minutes, patient will feel there is comfort level in the spine. The pain is reduced. Immediately. Once you feel the pain is reduced, you presume this is still Samavastha. Go on giving Sodhan Nasya, second day, third day, fourth day, fifth day. When patient feels, I'm feeling so light, so comfortable, mobility has improved, pain is reduced, inflammatory condition is reduced, then you may switch over to Shaman or Brown Nasya. Of course, along with Nasya, you are giving treatment for the spine. Then you may give Basti or you may give whatever is required then. But Nasya will give you direction. Right? चोर के लिए भागने का एक ही रास्ता है, एक ही गली है. पुलिस के लिए ढूंढने, चोर को ढूंढने के लिए so many गलीज, where you will find the चोर. So many गलीज में से आप नस्य करेंगे ना, तो वो गली कम से कम फिक्स होगी, ये गली में गया होगा वो. So you will be benefited. You will be able to catch चोर very easily. So it is Nasya. Along with Nasya, you may give, other line of treatment like Basti or whatever is required. Right? Anything else? You master Nasya. I think there should be a course, MD in Nasya Chikitsa. The topic should be Nasya Chikitsa. Then PhD in Nasya Chikitsa. Not only Panchakarma. It is only Nasya. Time will come, there will be right cataract specialist, left cataract specialist, right tonsil specialist, left tonsillar specialist. So similarly in Panchakarma, this is the Nasya specialist. This is what is my feeling.
Yes, sir.
Continue putting Nasya every day. And make a note of it. Make a diary. whatever changes patient feels, ask the patient to call you up for any changes. Then depending on the different changes or different response from the patient, you may change the Nasya pattern. Right? Is that clear?
Yes, sir.
Okay.
Thank you, sir.
Most welcome. Yes, Avdut?
Yes, sir. So from today's questions, we could make out that many of the participants have used Nasya for themselves also and for patients also. So as many
Now
of
they will
the
start using Nasya, then they will start Nasya in multifold way.
yes, sir,
Huh?
definitely.
Good.
And this will give rise to more questions also, more practical questions. So I request everyone to those who haven't used Nasya for themselves or for patients in these coming week, at least use for yourself and for your patients also. And then if you come across any practical difficulty, you can post your question again here. The new questions also, those who have already used Nasya, then also you can put your questions in the group, and we will address them in the next session. If any practical difficulty is there in still understanding the question or process of Nasya, you can put your question there also.
I will request all of you that
Yes,
while
Seema,
practicing Nasya,
anything else?
hello, I will give you one suggestion. While practicing Nasya, even if you make little mistake, don't worry. Don't be afraid of using Nasya. Most of the times you won't be wrong in selecting Nasya. But even if there is slightest mistake, that can be covered up without any problem. So don't be afraid of using the Nasya. And don't feel ashamed of making any mistake while putting the Nasya. You will learn from each and every patient, each and every single day. Right?
So we can make it simple for them, for all the participants. What you can do is, you keep 3 simple things in your clinic. Very, very simple things. One is Shunti Pradaman. One is Gud Shunti Nasya. We posted the method of how to make Gud Shunti Nasya. And the third thing is Shunti Grit Nasya. Okay?
No,
This will be simpler.
Instead of Gud Shunti Grit Nasya, it is difficult to prepare. It is not available that easily. But Panchagavya Nasya is available easily.
Correct. Yes.
So three different Nasyas.
These 3 Nasyas are very simple to keep in the clinic, and you make it a point that whichever patient comes to you, when you have examined, think of which Nasya you would put or administer to the patient to diagnose and use it also as a therapy. So what you can do is, for the coming week, you can start writing a list of diseases in which you have used the Nasya and which Nasya you have used. What is the result that you have got? So start documenting. So by 1 week, we will have huge data. Even if you start putting it for yourself every day, you will see different changes. Same way, when you start putting it for the patient, you have to give the Nasya to the patient at home. It's not that you just do it at the clinic. You have to give them the Shunti Pradaman to be done at home. Or if you are giving Shunti Gud Nasya, it has to be done at the home by the patient. You give, if Panchagavya Grit is required, you give the Nasya to the patient at home for daily administration. There is no need of all the pre-karmas and post-karmas. It's a Sadhya Nasya. So how like you do a Sadhya Vaman, same way you're going to administer or ask the patient to use the Sadhya Nasya at home. Now, our purpose for the lecture is that all of you should start using the Nasya. Just listening to the lecture doesn't make any sense. You can gain all the knowledge, but if you don't put it to practice, it's not going to make any sense. You will get confident only and only after practicing it. Even when you have a difficulty while putting the Nasya or selecting which Nasya you want to put in your clinic for your patient, you can give us a call. We are ready to help you, but at least start practicing. You can call that same time, either Dr. Snehil, Dr. Dattatreya, myself. We are readily available. We will help you out at that moment also, but please start using it. Those who have not used Nasya up till now, you can put the message on the group. Please let us know what is the exact difficulty that you are facing, what is the inhibition that is causing you not to put Nasya or use it for your patients. And those who have used it, what we can do is we can plan out a common document for all of us, like a common Excel sheet, where everybody of you can start putting that you have used this kind of a Nasya in this patient and this is the result that you have got. So we'll make a common sheet for all of us and we'll put it in the group, like an Excel sheet, and everybody can be updating it every day. So then we can, everybody will get inspired also looking at that sheet. Plus, there will be a lot of data gathering also, and you can learn from other person's experience. Okay, this doctor has used it for this purpose. This doctor has used it for this purpose. So let me also try for my patient and let me see what is the result. I think that should sum up. If anything is still left, then Snehil, that Avadut, sir, you can add.
Thank you, everybody, and wish you all the best in practicing Nasya and getting more and more confidence and more number of patients you will get.
Thank you, sir. Thank you so much, sir.
You're most welcome.
Thank you, sir. Thank you so much, sir. Thank you. Thank you, Hima. And that's a very good idea, Hima, so that सब जगह पे एक ही डाटा हो जाएगा तो हम लोग भी उसमें लिख सकते हैं हमारे पेशेंट का क्या आउटपुट हमको मिलता है. मैंने लास्ट वीक से अभी 6 दिन हो गए मुझे नस्ये को यूज करते हुए. फ्रॉम 25th आई एम स्टार्टेड इट. तो डेली अभी मेरी जो कंपाउंडर है वो भी बहुत हैप्पी हो गई है और वो रोज सुबह वो बनाती है अपने आप से और क्लिनिक में वो बॉटल रख के रखती है और हर पेशेंट को मैं भी करती हूँ और वो भी करती है. तो इट्स वेरी नाइस. So thank you so much, sir, for this wonderful insight.
Pallavi, easiest way to practice Nasya is, of course, you will be using Nasya for yourself and for your near ones and dear ones. But for the patient, you may give one empty bottle of Nasya, give ginger powder in one bottle, and if required, Panchagavya Grit, one bottle, 5 ml or 10 ml. Give to the patient to be used readily when the patient reaches home. It is ready for the patient to use the Nasya, right?
Yes.
We give one bottle, empty bottle for preparing good Sulti Nasya, one bottle of Panchagavya Nasya, and we give our own ginger powder, which is without lime, and it is finely mashed, and it is filtered through a very thin cloth, so it becomes a very small particle size, easy to administer as a Sunti Pradhaman Nasya. So give it to the patient as a complimentary.
Yes, sir.
Right?
Yes, sir.
Okay.
Thank you, sir. Thank you so much.
Most welcome. All the best. Good night.
Good night.
हाँ બીજું કઈ હિમા?
Thanks, sir. I think બધા વાપરવાનું શરૂ કરશે અને એક્સપિરિયન્સ શેર કરશે તો જ પ્રેક્ટિસમાં આવશે તો જ કઈ થશે. તો જસ્ટ બી એન આઈડિયા કે નસ્ય કરી શકે.
બહુ સારું. ચાલો.
ઓકે. Good night.
Thank you, sir.
Okay.
Good night, sir.
You're most welcome.
Thanks, sir.
Most welcome. Thanks will not be enough unless you practice.
Thank you, sir. Good night. We will surely practice.
That's the courage. spontaneous response.
Yes,
Thank you
yes,
so
they've
much.
already started implementing.
Thank you, sir. You're welcome.
Thank you, sir. Good night. Thanks, ma'am.
Good night. Most welcome. Good night.
Thank you.
Thank you, Avdut, Snehil, Hima.
Thank you, sir.
Thank you. Thank you. Thank you.
Bye.
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 Thank you.
Bye.
Good night. Good night. Good night.